More on today's pediatric vaccinations with Dr. Moriel Creencia of the National Children's Hospital. Doctor, maraming salamat po for joining us on The Final Word. Ilan po ang mga bata from 5 to 11 years old ang nagpabakuna ngayong araw na ito sa National Children's Hospital?
Sir, we have a total of 227 patients who are vaccinated today. Actually, the number was 229, but the two kids, the first one was less than 5 years old, and the other one really does not want to be vaccinated. So we were able to vaccinate 227.
So 227 in total on the first day of the vaccination drive for 5 to 11 years old. Yung nagpabakuna po ngayon, araw na ito,
sir.
What is the interval for their second dose?
Yeah, they have to come back 3 weeks after. They were told to come back 3 weeks after the first dose, and that is about February 28. So they will have to be back.
Out of the 227, Dr. Creencia, were there side effects among the kids who were vaccinated?
Sir, what we did was we let the kids stay for about 15 to 30 minutes. If you have a history of allergy or anaphylaxis, then you have to stay for 30 minutes. Normally those who do not have history of allergy, they were told to stay. We monitored them for 15 minutes. And so far, out of the 227 did not show any reaction. Well, some complained just pain during the injection, but other than that, none.
So that's overall good news,
No
Dr.
reaction so
Creencia,
far.
no side effects
Yeah.
among the 227 kids who
Yes,
were
po.
vaccinated today. And as you mentioned, there was one who refused to get vaccinated. But did you face any kind of situation today where a parent or the guardian hesitated to have their child vaccinated or backed out at the last minute?
No, none. Actually, the way when we tried to interview patients and parents who were there queuing, it seems that the children are even more excited and wanting to be vaccinated. And of course, the parents were very supportive because the usual reasons given was that they want to go back to school. They want to go out to the malls and to vacation sites like Boracay. So, and in fact, parents really did not have problems as far as convincing their children to be vaccinated.
Well, that is a great incentive, no? For them to get vaccinated, they can travel, they can go to the malls, they can just get out of the house where they have been cooped up, doctor, no? For the past 2.5 years. But of course, there are still a lot of parents, doctor, no? Who are still hesitant to get their children vaccinated, especially the younger ones, the 5 to 11-year-old age range. What do you say to the parents who are still hesitant to get their children vaccinated against COVID-19? Because this is just the first day. This will be an ongoing effort to get the millions of kids out there immunized.
Okay, so first things, it was proven in other countries and it has been backed up by the Philippine Pediatric Society and the Philippine Medical Association and PIDSP that vaccination, COVID vaccines are actually safe, no? And then the second one is we really have to, tell our children and encourage them because gadgets, actually, it's not good for children to be just interacting with gadgets because nothing can really replace a face-to-face interaction because like what the children would say, they really want, and it's really very important for these children to go back to school, to face their classmates, play with them, rather than play with gadgets. So that because as you know, even in children, we have the so-called mental depression.
Yes,
and you know, again, it's different. It's a very different interacting with just gadgets or your cell
Yes.
phone or your iPad.
Yes.
It's better talaga kapag ka po merong face to face, and aside from that, actually one worry that we had was that since there are children, the 5 years old and the 6 years old now,
Yes.
who started their kindergarten or preschooling or
Yeah.
even grade 1 when the pandemic started. And
Doctor,
what worried, yeah.
Doctor, the focus no over the past week and of course over the next months will be the immunization and the vaccination of these kids from 5 to 11 years old.
Yes.
Is this affecting in any way the routine vaccination of infants and kids for measles, chickenpox, and polio?
No. We still tell the parents that even, I mean, aside from the COVID vaccines, children still have to undergo the usual vaccines that are supposed to be given to them based on age, like measles at 9 months,
Correct.
the polio vaccine during the 2nd, 4th, and 6th month, and all of those vaccines that are really important because these vaccines are really needed for children to be protected later on in life.
So Doctor, a final question, no? Basically, those who attended and those who had themselves vaccinated, today, many of them were pre-registered. Will you be accepting walk-ins, let's say tomorrow and in the coming days?
Yes, of course, because as I have previously said, we have a registration for those walk-in. And we also have a registration area for pre-registered. And therefore, all walk-ins from all parts of the country even are welcome at NCH. And, it's actually the mandate of the Department of Health for us to give this service to these children, which they really deserve.
Thank you very much, and all the best to the National Children's Hospital, Dr. Moriel Creencia.